Do you feel embarrassed because your bladder disrupts many of your social interactions with people?
Water is good for you. You should drink lots of water.
Oh, really? Thank you. I don't mind if I do.
I don't like drinking too much water.
Really? Can I have your cup?
Yeah, it's fine. Drink too much water.
You know, it's actually very good for your skin.
You know, like, but I feel like you drink too much. Do you want me to turn off the air conditioning?
Where's your bathroom?
Over here?
Okay. Ow.
There's someone inside.
Hey, is everything okay?
Yeah. I just need the bathroom badly.
Oh, okay. I mean, it's not like you're gonna pee on yourself. You can hold it, right? Oh my god.
Stop. Or do you wake up in the middle of the night due to your bladder feeling like it's going to explode? Sometimes using the bathroom comes easier to some of us than others. Well, you're in luck because we are going to teach you the basics of the urinary system. Crash course on urinary output. Retention, hydration. Okay, average. Probably needs to drink water.
My name is Rufeida and I'll be describing the structure of the urinary system. So the main components of the urinary system are the kidneys. They look like lima beans. They are located behind the peritoneal membrane. There are two kinds of kidney. There are two kidneys, left and right. The right kidney is slightly lower than the left because the liver is located above the right liver. Then we have the ureters, and they are narrow muscular tube that produce peristaltic type movement to push down the urine. And the ureters travels from the abdominal cavity down to the pelvis cavity where they connect to the urinary bladder. And then we have the urinary bladder. The urinary bladder is made from elastic fibers and involuntary muscle fibers that help the bladder expand and hold variable amount of urine. And then we have the urethra, and it's the lowest part of the urinary tract, and it's a narrow tube where the urine exits the body. In men, the urethra is longer than in women. And then we are going to talk about the kidney specifically. So the kidney is divided into three divisions. The outer layer is called the renal cortex, and the middle layer is called the renal medulla. And inside the medulla there are triangular divisions called the renal pyramids. And the innermost of the renal pyramids are called the renal papilla. And then the last region is called the renal pelvis. And the renal pelvis is an extension of the ureter. And this division are called clysis. These divisions are called clycus, and they receive the urine from the cortex and medulla. And then we have the capsule that surrounds the kidney, and it gives it protection from trauma and damage, and it is composed of adipose tissue. And lastly, I'll be talking about the microscopic structure. So the nephrons are the microscopic structure that make up the kidney, and they are the functional unit of the kidney. So the nephron is made of two components, the renal capsule, and it is the Bowman capsule surrounding the glomerulus. And the glomerulus are a network of capillaries. And then the second component is the renal tube, and then there are four tubes. One is the proximal convoluted tube, and then the nephron loop, and then the distal convoluted tube. And then lastly is the collecting duct, and here's where several nephrons join to form a single collecting duct. And then we have two types of nephron, cortical nephron and juxtamedullary nephron. The cortical nephron is located in the outer part of the cortex, and they have shorter loops. And lastly we have the juxtamedullary nephron, and they are near the medulla, and they have longer loops.
Good morning. Today I'm going to be talking about the function of the kidney and the formation of urine. The kidney is used to excrete toxins and waste from the blood. It also helps regulate levels of many chemicals in the blood, maintain water and balance by excreting the extra fluid and retaining if it's less. It also helps regulate the blood pressure and blood volume. Another important function of the kidneys is it helps regulate red blood cell production by secreting something called EPO. I'm going to be talking about the formation of urine and how it's broken down into three: filtration, reabsorption, and secretion. Filtration of the urine goes on the kidney, and it's continuously. And this is when the blood pressure causes the water to dissolve substances into the capsule, the Bowman capsule. That's the one that dissolves in our body, and some of it is kept and some of it is taken out. And the normal rate per minute is 125. The ones that are kept in place it goes back into our body and it's used for circulation. That's called reabsorption, sorry. And that's a movement of substance out of the rental tubes, which are kind of these things that kind of look like vessels around your kidneys, that they go back and the blood goes into the capillary arteries. It's located through your kidneys, and they're the things that help you get water, nutrients, sodium, and other ions. And secretion is the opposite of reabsorption. So it's moving the substances out of the blood into the urine with hydrogen ions, potassium, and certain drugs that are secreted by active support. Thank you.
We've learned that urine is formed in the kidneys and it must be eliminated from the body. I will begin by describing the anatomy and the structures involved in the elimination of urine. First comes the renal pelvis. Urine drains into the renal pelvis, which is located in the kidney. The renal pelvis is connected to narrow tubes called ureters, which are no less than 6 millimeters wide and 25 to 30 centimeters long. The ureters and renal pelvis are lined with a mucous membrane made of stretchable transitional epithelium. The ureter also has a thick muscular wall. The muscle contractions produce peristaltic-type movements to assist in the movement of urine down to the bladder. Next is the urinary bladder. The empty bladder lies in the pelvis just behind the pubic symphysis. However, when full of urine, it projects upwards to the lower portion of the abdominal cavity. In women, the bladder sits in front of the uterus, and in men, it rests on the prostate. The walls of the urinary bladder are made of elastic fibers and involuntary muscles, which make it well suited for expansion to hold urine and contractions to empty itself. The urinary bladder is lined with a transitional epithelial, stretchy mucous membrane. It is loosely attached to the deeper muscular layer so that the bladder is very wrinkled in folds called rugae. When the bladder fills, these folds will stretch out to the point where they're smooth. However, there is one triangular area on the lower surface of the bladder that is free of rugae. It's called the trigone. It extends from the opening of the two ureters to the point of exit of the urethra. Lastly, we're going to talk about the urethra and the external opening called the urinary meatus. The urethra is the lowest part of the urinary tract. It is about 4 centimeters long in women and up to 20 centimeters long in men. It actually performs two functions in men, the elimination of urine and the passageway of reproductive fluid. So that's all for the anatomy and the structures involved in elimination. Now we will talk about micturition, urination, or voiding, whichever you prefer, as they all have the same meaning, emptying of the bladder. The journey of elimination begins at the renal pelvis. After that, urine drains into the ureter. Peristaltic movements aid in the movement of urine down to the bladder. As the bladder fills with urine, it expands. Two sphincters act as valves that stop urine from flowing out of the body. The internal sphincter is located at the exit of the bladder and is involuntary, whereas the external sphincter circles the urethra and it is voluntary. When contracted, both sphincters seal off the bladder, allowing it to be filled with urine. As the bladder stretches, nerve impulses are transmitted to the second, third, and fourth sacral segments of the spinal cord, and the emptying reflex is initiated. The reflex causes the muscles of the bladder to contract and the internal sphincter to relax. Urine enters the urethra, and voluntary relaxation of the external sphincter releases urine. Let's say you are not ready to void yet. You want to hold it in. Maybe it's not a suitable time. Well then, voluntary contraction of the external sphincter suppresses the emptying reflex until the bladder is filled to capacity and loss of control occurs. Adults usually do not void less than 350 liters of urine. But however, when the bladder fills with about 150 liters, you tend to want to go to the toilet.
Homeostasis. Oh, Mr. Yassin will kill me if I don't know what homeostasis is by now. Oh, hey, I didn't see you there. Well, as a nursing student and someone who's studying anatomy and physiology in general, it's very important to understand what is homeostasis. We've heard about this word for 2 semesters. Homeostasis, in a simplified term, I would say it's to maintain a balance. Why is this important for the urinary system? Well, for starters, the urinary system is in charge of making urine, okay? That's very important for our body in order to maintain homeostasis. We intake salts all the time, and these things need to come out. These toxins need to come out, whether it comes from our bloodstream or whether it comes from within our body. So I would say that if your body is not able to maintain this homeostasis and is not able to regulate the outtake and the intake, then that could be a problem, because you could be facing kidney failure. And if kidney failure happens, you may lose your life. One of the ways you can get kidney failure is actually by drinking alcohol or eating very, 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 very unhealthy foods that maintain high sodium levels. All this stuff is very unbeneficial for your kidneys. 2 types of balances in charge: acid-based balance and water-based balance from the blood, okay? And you don't drink your water, you can mess up your whole system. So I would say stay hydrated, eat healthy, exercise regularly, and make sure that your kidneys are functioning properly. Sometimes you could be born with some genetic disorders that could leave you needing dialysis or other things. But if you don't have kidney stones and your kidney is in good shape and your other urinary organs are in good shape, then you should be good to go, and try to maintain that for as long as possible, because it is important for your whole body. Your urinary system works with all your other systems. Thank you for coming to my TED Talk.